So here is a probe. Now, why is high-level disinfection? Endocavity probe is necessary. The disinfected area, the area, as you can see, that would have direct contact with a mucous membrane, for instance, and there's certainly a risk of contamination due to damaged condoms. Condoms often fail, and what's more, as you remove the condom, you might contaminate the underlying probe. The handle is not an area that is often disinfected in chemical disinfection, but there is a risk of contaminating the handle, even though it does not have direct contact with the non-intact skin or the mucous membrane, through contamination of hands or gloves which have touched the patient or have touched the probe that had contact with the mucous membrane. So another question for you. Are you aware of the infection risk when low-level disinfection was used instead of high-level disinfection for disinfection of endocavity ultrasound probes? And I should say by endocavity probes, I just want to be exactly clear. We're talking about probes that would enter, say, the esophagus, such as for transesophageal echocardiography, or enter the vagina or rectum for ultrasound of internal body organs. Good, excellent. Thank you for sharing your results with us. And I see about roughly 3/4 of you are aware of the infection risk when low-level disinfection is used instead of high-level disinfection, the disinfection of endocavity ultrasound probes. And then about 25% of you are either know or not sure. Again, this is an area that we're going to cover in some detail in just a few moments. So research shows that transvaginal probe contamination, despite probe cover and low-level disinfection. First of all, one should note that 10 to 15% of probe covers will have tears, allowing the entrance of microorganisms from the mucous membrane directly onto the probe. In one study, before disinfection, roughly 1/3 of transvaginal probes had prevalent bacterial contamination after the probe sheath was removed. And again, this can either be through a damaged sheath or by contamination as the sheath is being removed there. 80% of probe handles have residual pathogens, including such pathogens such as MRSA, and even further, more proximal, 62% of transducer cables showed microbial contamination. A meta-analysis found the procedures using low-level disinfection wipes, contamination remained importantly up to 13% for pathogenic bacteria and 1% for pathogenic viruses on endocavity probes. And this is because obviously when you use a probe wipe, you need to have contact of the wipe for a sufficient time of every single surface. So if there is either insufficient time, improper use of the wipe, meaning it already had dried out, or you missed a little piece of the probe, then you end up with residual contamination. And there are many studies out there showing that despite probe covers and low-level disinfection, pathogens remain on the probe. Of particular importance, of course, is HPV, human papillomavirus, and you can see here studies from Hong Kong, France, Spain, and another study from France showing that these probes, when tested after use, anywhere from about 3% to as high as 15% were positive for HPV as measured by looking at genetic material. The study highlights low-level disinfection to be insufficient. A retrospective study from 2010 to 2016 revealed an increase in infection risk in the 30 days following transvaginal ultrasound. These patients were found to be at roughly 40% greater risk and a 26% greater risk of needing an antibiotic prescription in the 30 days following their transvaginal ultrasound. So we've noted here that this is quite important. So it's not just a laboratory finding that these probes might have, and certainly do have, pathogenic bacteria or viruses after use in a patient with probe covers and low-level disinfection. But clinically, there is a substantial risk to the patient of acquiring an infectious disease requiring therapy. Now, again, infection risks of low-level disinfection of endocavity probes. This was a computer model. The goal was to assess risk for transmission of infection via endorectal or vaginal ultrasound probes using probe covers and low-level disinfection in France. I was a co-author of this study. Method was a stochastic Monte Carlo simulation. The results showed over France there'd be 40 new HIV infections. For other viral diseases, a range of somewhere between about 1,500 and 15,000 other viral diseases. And the conclusion is one must adhere to the guidelines from the Centers for Disease Control for the use of high-level disinfection, which, as we've already seen, are really the standard from across the world. On the right, you can see an actual reproduction of a table from that paper, and you can read that in detail. The references are all listed for you at the end of this presentation. But you can see the risks include HIV, hepatitis B, hepatitis C, human herpes simplex virus 2, HPV, importantly, the most difficult to inactivate, CMV, and chlamydia trachomatis. So a variety of viral and bacterial pathogens that would remain on a used probe that could infect the other patient, and as you've seen in this modeling study, lead to a substantial number of infections in a country about the size of France. So if you think compliance is expensive, certainly try non-compliance. This from a U.S. Deputy Attorney General there. So in the United States, failure to perform correct disinfection certainly has led to substantial legal risks, expensive lawsuits filed against hospitals as well as individual practitioners for improper probe disinfection and putting patients at risk, as well as another case of patients possibly exposed to sexually transmitted diseases. So this is why disinfection of endocavity ultrasound probes is necessary.